All right. Welcome everyone to our presentation this evening. I am Doreen Heineman. I'm the program manager of the Sashbear Foundation. And I want to welcome you to this presentation, which has turned out to be immensely popular. We will have hundreds of people online with us today from around the world. So welcome to you all for this very important discussion. I want to thank you all for being here, and I will introduce the others who are here with me. I'm joined by Lynn Curry, who is the co-founder and president of the Sashbear Foundation. Thank you, Lynn, for all of your work. I'm also joined by Kathleen and Barb, who are volunteers with the Sashbear Foundation, and they'll be helping me out behind the scenes. The Sashbear Foundation is a charitable organization. We're based in Canada, and we do work around the issue of emotion dysregulation and the dissemination of skills to those who have emotion dysregulation, sometimes known as BPD, borderline personality disorder, and also work with families. One of our major activities is providing the Family Connections program to individuals across the country. And you can find more information about Family Connections, about our other expert education webinars, which have all been recorded, and our other activities, including our annual walk, by going to our website, which is sashbear.org. I want to let you know this evening that this is being presented in webinar format. And what that means is that you are all hidden. Your cameras are automatically turned off. Your microphones are automatically muted. And so therefore you don't need to worry about behaving yourselves or interrupting us. Your dogs can bark, your children can interrupt you. You can eat your dinner, and that's all absolutely fine. You can communicate with us running the webinar through either the chat or the Q&A. At the end of the presentation, we will have time for some questions, and Kathleen, Barb, and I will be moderating the questions. With an audience of this size and such a broad topic of interest, we will not be able to address all of the questions. So I want to thank you in advance for submitting your questions and apologize that we will not be able to get to them all. But please do feel free to submit your questions, and we'll do our very best. If you want to submit your question anonymously, please be sure to use the Q&A function. The chat question will show your identity when you, whatever it was that you logged in with. Beyond that, what I would like to just mention is, again, the Sashbear Foundation is a charity, and so we welcome donations. If you find that any of our programming is helpful to you, we offer all of our services free of charge. And we do accept donations through Canada Helps. We're also beginning our major fundraising season, which is connected to the Sashbear Walk, which is an annual awareness raising event and tied to a fundraiser. And so we will be having in-person events in 5 cities across Canada throughout the months of May and June. We'll be in Surrey, BC, in Toronto, Ontario, Montreal, Quebec, Edmonton, Alberta, and St. John's, Newfoundland. And I realized I didn't go in order across the country, but those are the chronological dates of those particular events. And we also have an online fundraiser that happens during May 3rd to June 17th. If you're on our mailing list, you'll receive more information about that, and registration will open, I believe, on April the 1st. So with that, I would like to introduce our guest speaker. So let me just pull up that my notes so that I can introduce her. We're joined this evening by Lindsay Fulham, and we're so happy to have her with us. Lindsay Fulham is a clinical psychology PhD student in the Treating and Understanding Life-Threatening Behavior and Post-Traumatic Stress Lab, that's also known as the TULIP Lab, at York University in Toronto, Canada. And it is under the supervision of Dr. Skye Fitzpatrick. And some of you may be familiar with Skye Fitzpatrick's work. She has done some presentations for us in the past on topics around relationship, particularly partner relationships, and the relationship of trauma to borderline personality disorder. So Lindsay is doing her research under Skye's supervision at the TULIP Lab. Lindsay received her MA in forensic psychology at Carleton University, and she's worked in various research settings, including Public Safety Canada and the Forensic Early Intervention Service, which is at the Centre for Addiction and Mental Health, CAMH, a major mental health hospital in Ontario. Lindsay has presented her research at various national and international conferences, and her primary research interests are in the area of borderline personality disorder, specifically investigating the relationship between interpersonal problems and core BPD symptoms such as chronic feelings of emptiness, identity diffusion, emotion dysregulation, self-harm, and suicidal behavior. And some of her other interests include scalable interventions for BPD and PTSD, as well as how to support family members of individuals who are living with these disorders. So Lindsay, please add to that if there's anything else that you would like us to know about you. And at this point in time, I will turn things over to you. Please take it away.
Thank you so much, Doreen. That was an amazing introduction. I got a little bit of an ego boost from that, so thank you so much. I don't really have anything else to add. I think you kind of covered all of the main things about me. I am so honored to be speaking with you all today. I just want to say I'm a huge fan of Sashbear and all of the incredible work that you do for individuals suffering from BPD and related conditions and their loved ones and the community as well. So thank you for all of the amazing and inspirational work that you do. And also thank you everyone for being here tonight. Oh my God, like this is an amazing turnout. I was not expecting this whatsoever. So thanks to everyone taking the time to listen to me ramble on about these topics that I've currently been obsessing about a lot in recent years. So I hope that you all find this topic as interesting as I do. So with that, I'm going to go ahead and share my screen. Okay. And Doreen, you can see this? Okay. Yeah. Okay. All right. So I had a few, like one slide talking about who I am, but Doreen kind of covered the main points. I don't really have anything else to add, but I'll touch on a few more details about me. So yes, I am a PhD student in clinical psychology at York University. So a bit of a disclaimer, I'm not sure if I can call myself an expert just yet. I'm still very much a trainee. So I don't have a lot of clinical experience on this topic, but I can promise you that I've done a lot of research on it that I'm really excited to share with you all today. And yes, I'm also part of the Tulip Lab. Like Doreen said, you probably have seen my supervisor, Dr. Fitzpatrick, who's done previous webinars for Sashbear before, and we conduct research on BPD, PTSD, and how to effectively treat individuals with these conditions and how to support their loved ones as well. So I'm going to cover 5 main topics today. So first, I'm going to talk a little bit about emptiness, and then I'm going to move on to identity disturbance in BPD. Then I'm going to touch on why we should care about these symptoms as well as their potential causes. And finally, I'm going to end today's discussion about talking about what we can do about emptiness and identity disturbance in BPD. So some ideas about intervention strategies and how one might be able to support their loved one suffering from these symptoms. Okay, so first, as we know, BPD is a complex and severe personality disorder characterized by symptoms across various domains, namely emotional, cognitive, behavioral, interpersonal, and the self. We also know a lot about other symptoms of BPD, such as emotion dysregulation or instability, understandably, given that it's considered by some theories to be the core of BPD. However, there's a lot less research we're seeing examining the self domain of BPD. Specifically, chronic emptiness and identity disturbance remains to be these sort of elusive constructs that, while very common in BPD, they're much less understood compared to other symptoms of the disorder. So today, we're going to shine a light on these symptoms of BPD and give them the attention that they deserve, because as I will explain throughout this presentation, I think we really should be paying more attention to these symptoms. Okay, so let's start by talking about emptiness. In the DSM-5, chronic feelings of emptiness are one of the 9 diagnostic criteria of BPD. And these feelings are very common. One prevalence estimate in those with BPD is around 68.4%. And there's evidence that emptiness is more prevalent among women compared to men, and that it's more severe in older adults compared to younger adults. And of course, chronic emptiness, as the name implies, these feelings tend to linger for a long time in some folks. So in fact, one study found that among individuals with BPD, it's among the longest symptoms to remit or decrease over time, taking an average of 8 to 10 years to remit, which is a really long time. And for those who haven't experienced it themselves, you might be wondering, okay, well, what does that mean? What does emptiness mean? Well, there's actually no consensus definition of emptiness. And in the DSM-5, we just have chronic feelings of emptiness. Part of the reason for this is that it's unclear how it can be best conceptualized. Like, is it an emotion? Is it no emotion at all? Is it a symptom, or is it more of a global existential state? It also overlaps with other related constructs such as hopelessness, meaninglessness, loneliness, and boredom. And even though emptiness is thought to be something distinct or is experienced as something distinct in those with BPD, it's not entirely clear how these constructs can be teased apart. So as a result of these conceptual issues, emptiness has been sort of a tricky construct to assess and study empirically, which is likely part of the reason why we're seeing less research on it. But just to give you some idea of what emptiness might be, a study by Price et al. Has actually attempted to distill some of the core components of emptiness. So they used a thematic analysis of posts from different online platforms like Reddit and Quora, and came up with a bunch of items and tested them in a sample of university students and individuals with different psychiatric diagnoses, so not BPD specifically. And they came up with a definition of emptiness, which states that emptiness is a sense of absence, aloneness, unfulfillment, and disconnection from self and others. So while this definition pertains to emptiness in general and not specifically those with BPD, this gives us a better sense of how emptiness is experienced in BPD as well. So what does emptiness feel like then to those who experience it? So people who experience emptiness, including those with BPD, describe it in many different ways. So people might say, I feel empty inside simply, or that there's a hole in my chest, like the picture on the slide, or feeling like an empty shell. They'll also often describe a sense of meaninglessness, hopelessness, and that they're just going with emotions in life or feeling robotic or on autopilot. Some folks also describe an emotional numbness, like feeling like they have no emotions at all or feel nothing. And there's also a distinct sense of disconnection, either from oneself or others. So feeling really disconnected in some way. And this feeling is often uncomfortable. It aches in some way. And some people describe feeling a sense of yearning or longing to escape feeling of emptiness, this feeling of emptiness. It's also important to note that the feeling of emptiness overlaps with the experience of depression. So like I said, there may be feelings of hopelessness, boredom, low mood, etc. But individuals with BPD who experience emptiness describe it as feeling distinct from depression. This is actually one of the ways in which we assess emptiness in BPD, is whether it subjectively feels different from depression. So even though emptiness and depression often coexist, emptiness is this distinct feeling. Given that emotion dysregulation is the core feature of BPD, or is considered to be, how does emptiness then relate to emotions? Or like, what is the emotional profile of emptiness? So in my thesis research, I looked at how emptiness relates to emotions among individuals with BPD and how this differs across those with generalized anxiety disorder and healthy controls. So very briefly, without going into the nitty-gritty of my methodology, we found that emptiness is associated with higher subjective negative emotions, but lower physiological arousal in some domains, but not in others. And this may imply a potential function of emptiness, such that as intense negative emotions arise, emptiness functions to downregulate them or numb them. But because we didn't look at the causal relationship between emptiness and emotions, it could also mean that emptiness results from low emotional arousal, or that emptiness is distressing, so it causes negative emotions. So we can't really determine the causal relationship. But altogether, these results make sense given that individuals with BPD describe emptiness to be distressing, and at the same time, akin to a feeling of emotional numbness or low emotional arousal. Okay, so let's move on to identity disturbance then in BPD. Actually, before we start talking about identity disturbance, I think we also need to start by considering what identity or the self is. And I will say this is a massive topic. Philosophers and scientists have been pondering this question for centuries, and I will not do this justice. Instead, I will dedicate one slide towards talking about how complex identity is and how it's not so easy to define. So first, we all have a working definition of identity. It's the distinctive qualities or traits that make a person unique, right? But there's so many ways one can define oneself, including one's demographics, like their age, gender, sexual orientation, race, culture, also their personality, experiences, hobbies, talents, relationships, preferences, whether you like Friends or Seinfeld, because those are mutually exclusive. I could go on and on. Like there's almost no limit to what can be considered an aspect of one's identity. So defining one's own identity is inherently difficult. Identity can also be both subjective, like how one feels about themselves subjectively, as well as objective, like who a person is in terms of their observable or objective qualities. We can also think of identity as having different layers or levels. So including one's basic personality structure as like the first layer, going to one's subjective identity, like one's beliefs about who they are. Then moving farther out, we have one's social identity, like who one is in relation to their social relationships. And then at the outermost layer, we have one's collective or larger group identity. So who you are in terms of your membership in larger groups, like being Canadian, for example. And some aspects of identity are considered static, like one's temperament or basic personality structure, whereas others are more dynamic, like when one changes their beliefs or undergoes sort of a character development phase in their life, or changing depending on one's social role. There are some other really important considerations to highlight also when talking about identity disturbance, one being cultural differences. So studies suggest that different cultures may place varying degrees on importance of identity, or more precisely, more importance on one's uniqueness or distinguishing oneself. So for example, some research suggests that Western cultures tend to place greater emphasis on uniqueness and self-expression, whereas Eastern cultures tend to place greater emphasis on connecting to others and fitting in, which may impact how we understand and assess identity disturbance in individuals across different cultural groups. So for example, one thing we might really need to take into account is how our conceptualization of identity disturbance may be influenced by a historically white Eurocentric view of what is considered normal versus abnormal. The other important consideration that I want to highlight is the influence of age. It's considered normal for those who are in their adolescence, their teens, young adulthood to be going through a period of self-exploration where they may test out different identities to figure out who they are. And so we really need to be careful not to pathologize these very normal periods of identity development. And we also change to some extent across our lifespan, regardless of our age. So there's always some healthy degree of identity change that happens that we need to keep in mind. Finally, we should also take into account how certain individuals may be more fluid in certain domains of identity, such as gender and sexual orientation, which should not imply identity disturbance. And studies show that queer people are more likely to be diagnosed with BPD than straight and cisgender people. And one of the possible reasons for this is the identity disturbance criterion. So we really need to be careful not to pathologize diverse and fluid sexual orientations and gender identities. So overall, clearly identity is something that's super complex, super multifaceted and dynamic. So then if we were to talk about identity disturbance, one question is like, what is the healthy normative? Like, what is a healthy baseline that we're comparing it against? What does a well-functioning identity look like? And I'm not sure if I have the answer to these questions, but it's an interesting thing to think about when we're talking about identity disturbance. With all of those caveats aside, so let's get into talking about identity disturbance in BPD. So identity disturbance, or ID, is prevalent across different disorders like depression, eating disorders, dissociative disorders, psychosis. So it's not exclusive to BPD. And it's even considered a central feature of personality disorders in general because it is a disturbance in one's identity or sense of self. But it's particularly pronounced in BPD. One prevalence estimate is around 69%. And in the DSM-5, identity disturbance is described as sharp discontinuities in self-concept characterized by shifting goals, values, vocational aspirations, sudden changes in opinions about careers, sexual identity, values, and types of friends. But it's not just about these fluctuations in identity. They have to be experienced as distressing. So I think this is one way we can really tease apart healthy identity fluctuations from those that are more in line with BPD, is that it has to have that distressing component, that these fluctuations cause distress in some way. I should also note that sometimes the terms identity disturbance and identity diffusion are often used interchangeably, but sometimes identity diffusion refers to something more specific, such as role absorption or the inability to differentiate oneself from others, depending on the specific theoretical perspective. But from what I understand, identity disturbance seems to be a broader term that encompasses different types of identity and self-related problems. So altogether, identity disturbance seems to be defined by this switching or fluctuations between different self states, values, etc., that is experienced as distressing. And at the same time, there can be also this quality of rigidity or polarization of different self states. So one is either good or bad, exceptional or incompetent. So very dichotomous, black and white thinking about oneself. Identity disturbance can also manifest psychologically, such as a confusion regarding who one is or who one ought to be. Behaviorally, so switching between different personas depending on the situation, which is often described as like chameleon-like identity, as well as cognitively. So some studies actually suggest that individuals with BPD who experience identity disturbance also experience impairments in their autobiographical memories, marked by a lower coherence in their self-narratives and difficulty recalling specific memories. One study also found that identity disturbance can be divided into 4 factors. First one being role absorption, in which individuals tend to define themselves in terms of a single role or cause. So again, that rigidity in defining oneself. Painful incoherence, so a subjective sense of lack of coherence. Inconsistency, so an objective incoherence in thoughts, feelings, and behaviors, and a lack of commitment. So for example, to jobs or to values. And finally, while there are these like fluctuations in one's self-perceptions, overall, they tend to be more negative than positive. Okay, so why should we care then about emptiness and identity disturbance in BPD? It turns out there are many reasons to care. So first off, emptiness and identity disturbance are predictors of self-harm and suicidal behaviors in BPD. And in fact, some studies have found that both emptiness and identity disturbance are robust predictors of suicide attempts in those with BPD over time, over and above other symptoms of BPD. So these symptoms are particularly important when predicting suicidal behaviors. In terms of emptiness, qualitative research suggests that emptiness leads individuals to engage in self-harming behavior to escape the distress associated with feeling empty. So the idea that it's better to feel something, even if it's physical pain, than to feel nothing at all. Emptiness also makes sense in the context of suicidal behaviors because of its overlap with feelings of meaninglessness, hopelessness, loneliness, which are major risk factors of suicide. And in terms of identity disturbance, it's possible that a well-integrated and stable identity acts as sort of an anchor during periods of intense and unstable emotions. So when one is feeling really upset, they can draw on a more balanced perception of who they are, including their strengths, which may prevent them from swaying to the extreme end of like despair or self-loathing, that kind of thing. So having a strong sense of self may act as sort of a buffer in terms of times of distress, during times of distress, and that identity disturbance makes one more vulnerable to extreme negative emotions, which may thereby increase the likelihood of self-harm and suicidal behaviors. So that might explain the connection between identity disturbance and suicidality. Both emptiness and identity disturbance are also related to depression and dysphoric feelings like sadness, hopelessness, etc., like I said, as well as social dysfunction. So research suggests that individuals with BPD are more likely to experience emptiness after social encounters, and that identity disturbance is related to interpersonal problems, potentially due to dichotomous thinking about oneself and others, which may contribute to interpersonal stress. They also are found to be related to academic and work dysfunction. So for example, lower productivity or days out of work. Both symptoms are also found to be related to more severe BPD symptoms. So higher emptiness and higher identity disturbance is linked to more severe BPD pathology and slower remission rates, to such an extent that some have even theorized that the self cluster of BPD represents the core of the disorder that causes all other symptoms of BPD. Finally, both emptiness and identity disturbance have been linked to impulsive behaviors, such as substance use and addictive behaviors. For example, one study even found that identity disturbance is associated with opioid misuse as well as internet addiction, which is really interesting. Okay, so let's talk about some of the potential causes of emptiness and identity disturbance in BPD. So far I've been talking about emptiness and identity disturbance separately, but it's important to note that research suggests that these symptoms of BPD are intricately linked. In fact, they are highly correlated and share the greatest overlap with each other compared to other symptoms of BPD. And as I mentioned, they make up their own cluster, aka the self cluster in BPD. In addition to their statistical relationship, theories suggest that emptiness and identity disturbance are related. Specifically, while there are different models for what causes BPD and its various symptoms, many of these theories suggest the importance of relationships, particularly early and validating experiences from close others, in the development and maintenance of emptiness and identity disturbance. But it's unclear whether emptiness causes identity disturbance or vice versa. So for example, it's been proposed that early invalidating environments or experiences lead to intense emotions, which then result in emptiness coming online to numb these emotions. And as a result of feeling or having a lack of emotions or feeling nothing at all, this leads to difficulties with understanding oneself and forming an identity. Alternatively, it's also been proposed that early invalidating environments or experiences more directly leads to identity confusion or disturbance. So when an individual is told that they are overreacting or that their emotions are invalid or too much, this may lead to a tendency to question one's internal experiences and emotions, and a tendency to rely on others to define one's identity. And this may in turn lead to those fluctuations that we see in identity disturbance, fluctuation depending on who a person is with, or how they're feeling that day, which may cause an internal feeling of emptiness. So the idea that one exists only on the surface and is lacking an inner sense of consistency or authenticity. So it's a bit of a chicken and the egg argument. I mean, we can see how these symptoms are related to early relationships and to each other, but their causal relationship is really unclear. One recent model that I'm hoping to test out in my research attempts to explain the relationship between emptiness, identity disturbance, and other core symptoms of BPD. So it's based on a model by Kaufman and Madawi, which specifically theorizes that invalidating environments contribute to the development of identity disturbance and emptiness, such that invalidating environments that reject, trivialize, negate or neglect or ignore individuals' expressions of their private experiences lead them to mistrust their own internal cues, which leads to the development of identity disturbance and emptiness. This then also contributes to emotion dysregulation, which then also in turn leads to impulsive, dysregulated behaviors as sort of a maladaptive coping strategy. So this is based on the idea that interpersonal feedback is essential for the development of our identities. It helps us determine sort of the acceptability of our behaviors, helping us to distinguish ourselves from others and evaluate the accuracy of our self-appraisals, etc. They further hypothesize that it's not necessarily always operating in disorder. All of these things sort of reciprocally influence and exacerbate each other over time. And that importantly, invalidation is a key mechanism contributing to emptiness and identity pathology, as well as their detrimental outcomes. Okay, so now that we have a sense of the negative impact of emptiness and identity disturbance in BPD and their potential causes, now what do we do about these symptoms? Well, we don't really know. The empirical research that has been done on this topic suggests that DBT is effective in reducing emptiness and identity disturbance in BPD, but it's unclear what specific components of DBT are the most effective. So based on more theoretical work that I've seen in the literature and some of my own speculations mixed in, one of the things that I think might be really helpful is practicing mindfulness, especially for emptiness. So mindfulness practice theoretically has the opposite effect of emptiness. It's a turning towards emotions rather than away from them or numbing them. And this may be a way to at least practice more adaptive emotion regulation strategy, if we can conceptualize emptiness as a maladaptive emotion regulation strategy. So instead of numbing emotions, we're actually practicing tolerating them and accepting them. It's also possible that mindfulness may improve one's ability to participate and become one with experience, which may foster a sense of coherence with one's identity and sense of self. I think wise mind may also be really key here. So compassion for oneself and others, as well as finding the middle path in dialectical philosophy. So the idea of finding a synthesis between opposites rather than viewing oneself as all good or all bad, for example. So being comfortable living in those gray areas, those complexities. It's never about being all good or all bad. It's usually somewhere in between. And I think that might be really helpful for identity disturbance. Given that these symptoms are distressing, distress tolerance skills can also be helpful here as well. So with emptiness, there's often a need to escape these emotions. So if something like mindfulness is too difficult in the moment, perhaps something like exercise, or if emotions are really intense, using like your tip skills, manipulating temperature, etc., might be really helpful here. Or even using distraction in the moment. So engaging in activities that you enjoy, even better, given the sense of disconnection with these symptoms, reaching out to a friend, engaging in social activities, I think could be really helpful. Acceptance-based strategies might also be helpful here as well. So in acceptance and commitment therapy, or ACT, there's something called a values card sort, where one sorts cards containing different values in order of importance, which may be helpful with anchoring oneself to their core values. So then what can loved ones do? We also don't really know at this point how loved ones can help with these symptoms. And given that this is all speculative, we're hoping to test some of these ideas on how loved ones can best support individuals with BPD experiencing these symptoms. So my supervisor, Dr. Skye Fitzpatrick, has recently proposed a model known as the bias model, which outlines the different ways in which BPD symptoms reciprocally interact with loved ones in developing and maintaining BPD over time. So it's important to note that this is not the intention of any one person. It's just how these dynamic systems sort of interact with each other over time. And the beautiful thing about this model is that it highlights an opportunity to sort of harness the power of loved ones in the treatment of individuals with BPD. So given that invalidation and social disconnection has been identified as important mechanisms in both identity disturbance and emptiness, I really think that these symptoms represent a time when loved ones are really needed. So I think just simply being present with the person emotionally, physically, is really important. Showing your support, your love, telling that person how much they mean to you can really go a long way during these times. And I think that validation stands out to me as an important strategy for emptiness, and particularly identity disturbance. So practicing your validation skills, I think, is really key. You can also help encourage your loved one to use the skills that I mentioned on the previous slide, such as mindfulness, or encouraging them to tap into their wise mind where it can be helpful. And of course, we should also acknowledge that these symptoms can be really hard on loved ones, in addition to those with BPD. So making sure you practice self-compassion, loving kindness, self-care is really essential. Okay, some parting thoughts here. Overall, if I were to summarize everything, emptiness and identity disturbance are common, severe, and potentially dangerous symptoms of BPD. There does remain a lack of research on these symptoms in general. Some of the key pieces we are missing is research on what causes these symptoms, how they relate to negative outcomes such as suicidal behaviors and self-harm, and how we can effectively target them in treatment. So there's still a major void in this literature, but we are starting to fill the void. And I've noticed that there seems to be a new invigorated interest in these topics in recent years, which is really cool to see. And what I'm hoping to do in my research is to get a better sense of how these symptoms are experienced in those with BPD in everyday life, and whether something like interpersonal stress is a causal factor in these symptoms, and how they relate to impulsive urges and behaviors. So hopefully this research gives us a better sense of how treatment providers and loved ones can best support individuals with BPD who experience these really distressing and severe symptoms of the disorder. So stay tuned for this research. And okay, that's everything I have today. Thank you all so much for listening. And please, I encourage you to check out the Tulip Lab on social media. Our plugs are probably in the chat, or our handles are in the chat. So our team is working on posting more interesting research facts and information about BPD and mental health awareness. So feel free to check us out and drop us a line. And yeah, thank you so much for listening.
My camera is back. Great. Thank you so much, Lindsay. That was absolutely fascinating. And I have to admit, a lot of it, I think, went over my head. So there's just because these concepts are so abstract, right? And you're using vocabulary that has come to have some very specific meanings that help you to be able to pin it down and speak about it. And for a layperson, sometimes it may take us a little bit longer to get to sort of wrap our heads around some of these ideas. So the first question I want to ask you is, for those of us who want to learn more, people are asking, where do we go now? Is there information that's published? Are there websites? Is there anything else that we can do to learn more about these topics? Or is this still so much in its infancy that there isn't really anything out there?
Yeah, I mean, that's a great question. I do think that these topics are still in its infancy in terms of like any like specific books or resources on identity disturbance and emptiness specifically. I don't know of any off the top of my head, but one thing that has been helpful for me actually to learn more about how it's experienced in people has been social media, as well as there's a podcast that I listen to sometimes, is called Back from the Borderline. And there's an episode where the host talks about their experiences with emptiness and identity disturbance. There's different episodes on it, but if you're curious about that and how a person with a lived experience can describe these things, you might want to check that out. Of course, like in terms of research, like I said, there's not a lot out there. I could forward some kind of review papers that I'm thinking off the top of my head, but in terms of like general resources on these topics, I do think that they're very lacking. And which is why I'm excited to see this invigorated interest in these topics. And I hope to see more material written on it. And we hope to actually, as another plug for our social media, we hope to post more content on this kind of thing too, as well. So feel free to look out for that. If there's anything that anyone is interested in us looking into or posting more about, we're happy to do that. Yeah.
Great. Okay, thank you. Now I do have some more specific questions. So first of all, somebody asked right near the beginning, and you may have addressed this and it's possible I missed it, but the concept of dissociation is, also associated with BPD. So is dissociation a separate construct? Is it related to the emptiness piece? Is it related to the identity disturbance? Could you speak to that a little bit?
Yeah, as far as I know, it is a separate construct that is experienced in a lot of dissociative related conditions. So the experience of dissociation could range from like, feeling like you're not paying attention, or like dissociating in the moment from like just an attentional perspective, but also like someone has a traumatic experience, they may experience dissociation as well. So if they're in a situation that reminds them of an event of a traumatic experience, they may feel themselves like kind of like removing themselves from reality. It's kind of like a shift in one's perception of reality almost. So, I mean, with a lot of different disorders and symptoms, a lot of these things overlap. I'm sure that dissociation may relate to difficulties with feeling in the moment, or feeling. I'm not sure if there's any research on the relationship between emptiness and dissociation. I think that would be really interesting. But as far as I know, they're different in the sense that maybe something like emptiness is like I said, it's a distinct feeling of like a void almost. Like it's a distinct feeling that someone is acutely aware of in the moment, and it's distressing. And I think that they're kind of related because they might look the same in terms of like being distressing for some people. But yeah, I mean, as I think through that, those are tough to tease apart. But I do think that emptiness is something distinct because it does come from like, I think it comes, in my opinion, I think it comes from, it's a result of something distressing happening, whereas dissociation doesn't necessarily have to have that component. And also a need to escape that emotion as well, to escape the feeling of emptiness and dissociation, which we don't really see, which we don't really see with dissociation. So that is a really good question, I will say.
Great. Thank you. Thank you for your attempts to respond, because
thank you.
it's not, I mean, I think what I take from that really is that since you're not saying, oh yes, absolutely, it's connected, and this is the field where you're doing your research, then it's not as closely connected as some of us might think, right? Otherwise you would be saying, oh yes, absolutely, this is a piece of it.
Yeah, so. It's definitely, I will say it's an empirical question. That would be my answer.
Okay,
it's still
fabulous.
a scientific question.
Great, thank you. This is a very interesting question. Someone is asking, does a lack of empathy, presumably in a person's environment, a lack of empathy create a sense of emptiness? And I would think this might relate back to the idea of an invalidating environment, but perhaps you have something more to say about this concept of empathy.
Yeah, that is really interesting. I do wonder if, yeah, so like one of the theories that is coming to mind about emptiness is that it results from an inability to mentalize. So a difficulty understanding like one's feelings and mental processes and those of others. And so that strikes me as very similar to something like empathy. This is still largely theoretical, but that might speak to that question. There isn't like, probably this is the same answer for a lot of questions. There's not any research on that. But I do wonder if like it does feel, for someone who has difficulties with, say, emptiness and identity disturbance, feeling like who they are is changing depending on the situation, can feel like, can relate to a feeling of inauthenticity. So that might be speaking to like some of the feelings of like not empathizing, like feeling like you're not being like genuine in your social relationships. But I don't think that emptiness necessarily implies a lack of empathy. I think those are different. Those are definitely different things in my mind. But I can see how like empathy definitely depends. Like it is developed out of our social relationships. Social relationships are essential for developing those empathy skills. So because social relationships are also important in forming our identities and emptiness, I think that difficulties, you know, in your interpersonal relationships can relate to both, but those are different things. I would say that would be my hunch.
Great, thank you. And maybe for our audience, I just want to clarify once again that the diagnostic manual that's used in North America to diagnose borderline personality disorder talks about 9 different symptoms or criteria that are, you know, part of what BPD may look like. But people who have BPD don't necessarily have all 9 of these symptoms. And so Lindsay is speaking about 2 of them. There are 7 other symptoms. There are lots of people out there with BPD who don't have these specific symptoms. And so they're going to impact people to a greater or lesser extent. So I just want to sort of clarify that piece. and also then follow up. We're receiving a lot of questions that are more generally about treatment for BPD in general. And we won't really be able to address those questions this evening. I can say that there is research that shows very clearly that BPD is treatable and that people do and can recover from BPD. And the gold standard treatment that is most available throughout Canada is called dialectical behavior therapy, or DBT. And Lindsay has mentioned that specifically in terms of being helpful for these two criteria that she is speaking about tonight. So I encourage people to go look at some of our other expert ed webinars that have already been recorded. They'll answer some of your more general questions about BPD and about dialectical behavior therapy as a treatment. So returning back to what you've been talking about this evening, there are a couple questions that are asking about the impact of our social and cultural environment on the development of these types of symptoms. One of them is the isolation that occurred with the pandemic and what impact that might have had on this feeling of emptiness or in people's identity disturbance. And if you want to address these together or separately, another one is the idea of the internet and how it really encourages dichotomous thinking, or sort of black and white thinking, very extreme positions. Do either of those kinds of things, do you see them contributing to specifically these ideas of emptiness or identity disturbance?
Yeah, definitely. I think those are great questions. With the pandemic, I can definitely see how that has probably exacerbated some of these symptoms, in the sense that people were literally stuck in their homes. They were disconnected from their networks, disconnected from going into work, and a lot of these things that we do in our day-to-day lives, whether or not we're acutely aware of it, they give meaning to our lives in a lot of ways. And I think social connections also give meaning to our life. So feeling that disconnected, I feel that social disconnection piece, I think, probably has really exacerbated both of these symptoms in their own ways, in terms of like feeling like you're doing things that are meaningful, or feeling like your life is meaningful, and feeling those social connections. Because we know that social disconnection is a major factor in feeling empty. So yes, to the first question. To the second question, in terms of like in the internet fostering more extreme views, I think that I guess in terms of like, I do feel that sometimes there's this idea that something like social media can actually, while it's called social media, it makes us feel more disconnected from the world. And I do feel like part of that is true. We're losing out on like kind of meaningful face-to-face interactions a lot. It could also be really helpful for other people. I think it depends on the person, to be honest. But I also feel like things like, Instagram platforms where we're kind of showcasing to the world who we are, I do wonder if that has an effect on our sense of selves, in terms of like who like what we want to showcase and how that impacts our own self-perceptions, because social media is part of our world, our everyday lives now. It's fully integrated, and I feel that a lot of people, like our own identities are kind of merged into it, and to some extent. And so, yeah, I mean, it would be interesting to see the impact of like social media behaviors, like that, the interesting finding that internet addiction is related to identity disturbance. I think that might tell us how like the potential impact of internet use or social media use on these symptoms. But again, an interesting empirical question. I'm going to steal all of these ideas and run with them in my own research.
That's great. I'm so glad we could help with this. While you're speaking of research, a couple people have asked about whether or not any of the research studies at the Tulip Lab are currently recruiting. So I can speak to I know Dr. Fitzpatrick, who heads up the Tulip Lab, it does ongoing research on couple relationships, and we post the information. We provide it in the Sashbear newsletter that comes out every couple of months. So you can always sign up for our newsletter, and we always include information about any research studies that we're aware of. Typically, they're in Canada that are recruiting. And I believe, Lindsay, you may want to speak specifically about whether there's a possibility of research forthcoming, ones that you know of, or your research in particular. I don't know. It's up to you.
Yeah, so we do have some studies going on in the Tulip Lab that we are recruiting for. So specifically for individuals who are in a romantic relationship with someone who has BPD. There is a few posters on our website. So the Tulip Lab website, I could also pop it into the chat, where we are recruiting people to do, assessments on their phone. So they have to be willing to do that. Anyway, there's more information on the website, but specifically for people who are in a romantic relationship with individuals with BPD. In terms of my own research, I think that I probably will be posting some kind of poster or advertisement for some of the questions that I'm asking here today. So I don't have any specifics on that, but feel free to check back on the Tulip Lab website. There's, yes, thank you. So there's tons. We always post our research that we're conducting and recruiting participants for. So feel free to check back there.
Great. So yeah, check the chat for the social media handle for the Tulip Lab to keep on top of what research studies they're recruiting for. I have a couple questions coming in about how family members can try to how can we validate if we don't have a really good sense of what this feels like for our loved ones who may be experiencing these concepts of the emptiness or identity disturbance. Just before I throw that to you, there's a couple people out there in the audience who have BPD and who have described their own experience. One person says that they experience it as intense self-hatred and self-loathing. And in their experience, even working and learning DBT skills hasn't necessarily helped them to learn how to deal with that. And somebody else is mentioning that their sense of emptiness comes from feeling unseen, that they're sort of getting lost, and they feel like other people are more or bigger than they are, and they get lost in that. So I just want to throw those two thoughts out there, and maybe you can speak a little bit more as to how we as family members might help our loved ones tell us what they're experiencing, or how can we understand it better so that we can validate better?
Mm-hmm. Yeah, that's a great question. I really do feel that, being with the person and kind of practicing validation skills in terms of like what they're feeling, because emptiness can be different for different people. So there wouldn't be a specific way to say this is emptiness, and this is how it should be, described or validated, or this is what it looks like. But a lot of people report feeling like hopeless and lonely. And I feel like those are very, those are symptoms that we all experience from one time or another. And it definitely depends. It's different for every person. So I think just being physically or emotionally present with the person is really important because of that social disconnection piece. And also just I don't know if this is helpful for individuals with lived experiences, but practicing, I think that middle path philosophy is really key as well, the dialectical framework of practicing thinking within the gray areas can also be a helpful way to kind of give perspective to the situation. Because for a lot of individuals with BPD, it can feel either a black and white type of thing. It's either all bad or all good. So practicing considering all of the different things that might be true instead. So that, I guess that's more of a cognitive kind of technique of really kind of questioning whether or not this this idea makes sense, or this thought makes sense in the context of everything else. So more of like a considering all of the alternatives. Yeah, like in terms of loved ones, I mean, these symptoms are really hard to pick up on. Like they're more subtle than things like emotion dysregulation, and behavioral dysregulation. So it can be hard to pick up on. And I almost wonder if individuals with BPD also isolate themselves when they feel this way. So it's even more difficult for loved ones to intervene and to help out. So checking in on the individual, on your loved one, to see how they're feeling, and being present, and helping with those, emotion regulation strategies as well, because I think at the end of the day, it is something like emptiness is kind of an emotional experience. So I think a lot of the main principles and a lot of the main strategies in DBT can be really helpful, but particularly like those mindfulness practices, or thinking like in more of like in that gray area, I guess. I don't know if that answers your question, but there's some ideas I have at the top of my head.
That's great. Thank you. Thank you so much. Any kind of fulsome answer is going to spiral around the topic, yeah. and I think we landed with an answer that will satisfy, at least to some extent, the people who ask the question. I also want to note that I know there are people out in the audience who may be just beginning this journey with their family member, and they may not yet have had the opportunity to attend Family Connections. Family Connections, I'm just going to make a plug for it, is a 12-week program that has been researched, and it is specifically for family members of somebody who's dealing with emotion dysregulation. That may be BPD, it may not be diagnosed BPD. We offer the program here in Canada. It's also available internationally. So if you're in Canada and you haven't attended Family Connections and you would like to, please go to our website and you'll find the information to sign up. That's sashbear.org. And if you're anywhere else in the world, you can go to the website for NEABPD, which is neabpd.org, and they have the information for the program internationally. And like I said, it's provided free of charge for family members, and it is a research-driven program. And one of the things that we spend a lot of time on is teaching family members how to validate their loved ones effectively. So this idea of validating specifically around emptiness and identity disturbances is a little bit more complex, but the concept of validation is something that we can all learn. And one person out in the audience with BPD sent a message which said simply, family members need to listen and not dismiss. So if you find that you're not listening to your loved one and you are dismissing what they're saying to you, then maybe learning about validation is something that you can do. I think we are really past our time. So I want to thank Lindsay again. I will give you a moment for a closing thought, Lindsay, but I do want to just remind everybody out there that this presentation has been recorded, and in a week or so, we'll be posting it on our website at sashbear.org and on our YouTube channel. You can find more than 30 past presentations on our YouTube channel as well. So if there's a topic that we were not able to address specifically tonight, there might be a presentation already out there. Just to remind you once again that Sashbear.org is a charitable organization, and we welcome donations and we welcome volunteer involvement to help us with our work and to help us continue to reach family members and provide education and raise awareness around these issues. Once again, the recording of Lindsay's presentation will be available in a little while. You can also request the slides if you're interested in reviewing the slides that she has presented this evening. So with that, I will say thank you so much, Lindsay, for a really wonderful discussion and so interesting. I learned a lot, and I'm sure our audience did as well. And I just want to thank you so much for having taken the time to share your interest and your passion and your knowledge in this area with all of us. So I will hand it back to you if you have any closing thoughts. Thank you so much for having been with us.
Thank you so much for having me. This has been really fun. I am so just overwhelmingly happy with the turnout today. So I'm very happy that I got the chance to share this with you all. And hopefully I can be back with more updates on the study that I'm going to conduct on these topics. And have more information about, the clinical implications of this and how we can best treat it, because I think it's still very much an open question. And it's still very much an untapped area of research. So thank you for bearing with me with trying to figure out useful therapeutic strategies, but I think it's still very much an open question that I'm really excited to explore. So yes, thank you again for this opportunity. And I'm sure I will be back at some point again.
And we very much look forward to that. Thank you, everyone, for joining us. Have a good evening. Bye now.